Hey guys, so today I'm going to be talking about post-operative infections, even after you think you may be out of the woods. I am currently 6 weeks and 5 days post-op from a tummy tuck, extended tummy tuck with 360 lipo and a BBL, which I had done in Colombia. And I pretty much thought I was out of the woods. But yesterday I went to the gym after work, and because I've been cleared to do cardio, and I took off my regular faja and I put on this waist trainer. I'm sure you guys all have seen it or have used one. Now, I'm not saying that this waist trainer is what caused my issue, okay? So don't come at me. But I'm just telling you the story. So I had this on, I put on my gym clothes, was working out, and the skin around my hip started hurting, started burning. And so at first I just thought, maybe the waist trainer is frictioning or just not on quite right. So I kind of adjusted it and kept going with my cardio. I got home, and when I took off the waist trainer, I noticed a spot about the size of a quarter right over my hip bone that was red and swollen and a little raised, a little inflamed. And so I pushed on it. It's called to test for blanching. So I pushed down on it and it blanched, meaning the skin turned white for a brief second before it filled back up with blood, before it became pink again. And I figured, it's probably just, friction from the waist trainer. So I just kind of kept it in the back of my head, and I took a shower and I put on my faja and went to bed. So I woke up in the middle of the night last night and with a burning sensation. Now, I usually sleep on my left hip, which is where the spot was. And so I woke up with a burning sensation in my hip, and I figured, that spot was kind of tender earlier, so let me just take off my faja and go without it for the rest of the night. So I did that. When I woke up this morning, about 5:30 this morning, and I went to the bathroom, I noticed that the quarter size spot was now about the size of a grapefruit, and it was very tender. It just feels like burning and like tingly when I don't touch it, and then burning when I do touch it. So it was very sensitive. And that's when my nurse alarm kind of went off, because in the span of 10 hours, I went from a quarter size to a grapefruit size. And now the area is starting to feel a little warmer than the rest. So I proceeded to call my doctor's nurse, or I left her a voice message through WhatsApp and sent her some pictures so that she could see what I was talking about. And later on that morning, I got a call back from her, and it appears to be from we mutually agree that it appears to be what's called cellulitis. Which is essentially an infection of the tissue, so like of the skin. And so she recommended that I be on antibiotics. The doctor sent me a photo of a script of antibiotics that he wanted me to be on. Now, because I had surgery in Colombia, he has no legal authority to prescribe prescriptions here in the US. And so I actually already had a trip planned back to Colombia this coming weekend for some business I had to take care of. And so we agreed that when I went to Colombia, I would go and see him. on Monday. Now, today, at the date of this video, it is Tuesday. And whenever you suspect or have an infection, you never want to go longer than is absolutely necessary, or better said, you want to seek attention, medical attention immediately, because infections can run rapid and can penetrate into your circulatory system and cause sepsis, into your lymphatic system. It can even infect bone, etc. So, and a bone infection is very, very difficult and a long process to treat. So, all that to say that if you ever suspect an infection, you have to seek medical attention immediately. Luckily for me, I do have a clinic or an urgent care that I frequent whenever I need something, because I personally do not have insurance. And so I went to the clinic and showed the doctor, and he immediately prescribed me an injected antibiotic, which I got, and an anti-inflammatory, and then some oral antibiotics. So I'm already started taking the first doses of those, and we'll see what happens. As of right now, the infection feels angry. How can I tell? Well, it's progressed as the day has passed. So now it's a little bigger than it was even this morning. It is redder than it was earlier. It is still burning very much, so the pain has not subsided. In fact, it may have gotten a little worse. The tingling that was very kind of like a numb tingling is now like a more noticeable tingle. And when I touch it, it almost feels like I have a burn. So I'm gonna show you what I'm talking about right now, so that you can see what cellulitis looks like. And just as a side note, I don't think this had anything to do with the physician's quality and skills of the surgery. Like I said, I'm almost 7 weeks post-op, so the likelihood of this being an infection from the original surgery is highly, highly likely at this point. But I am saying that complications can happen at any point, or infections can happen at any point. Who knows how I ended up getting cellulitis? Maybe I scratched too hard and created a little opening in my skin, and germs got in it, and that's how I got it. Or I am pretty meticulous about washing my hands before I touch my incisions or anything, but you just really never know. Okay, so I will just give you some friendly nursing advice, and don't take this as medical advice. This is just me telling my story and the things that I'm doing that I feel will help. So obviously you need to take your antibiotics. Do not miss a dose. Try to take them at the same time every day. And I'm not going to be wearing my faja until the infection is gone. So today I've been religious about using my faja 24/7 except when I shower. And I went from that to today, I didn't put on my faja at all. So it is now the evening time since the morning that I haven't been wearing my faja. So I am definitely swollen, and unfortunately it's a necessary evil at this point. I'm not worried about the swelling right now. I'm worried about the infection and that clearing up. So you can check your temperature a couple times a day and see if there's any fluctuations in that if you're developing a fever. Now, nowadays, we all know what our normal temperature is, because we get our temperature taken everywhere we go. So if you have an increase of about a degree and a half, so if your normal temperature is 98 and now you're at 99.5, that would be considered a low-grade fever. My temperature is usually 96.7. So my temperature runs on the low side normally. So for me, if I were to have a temperature of 98.8, which some people might consider normal, a normal range, for me that would be considered a fever. So I just want to point that out because some people will say, oh, well, 98's normal or 98.8 is normal, so you don't have a fever. But what is your baseline? What is your temperature usually? So just keep that in mind. The opposite goes if your temperature runs a little on the higher side of normal. So just be mindful about that. So you can check your temperature every day. Make sure you take your antibiotics as instructed. And also, I'm going to mark myself. Now, this is a special skin marker, but you can use a Sharpie if you don't have anything else. And what I'm gonna do is I'm gonna outline exactly where all the redness is so that I can monitor and see how much or if the redness and swollen area is still spreading. Okay, and that's gonna be one of my best indicators as to whether the infection is improving or not improving. Because I'm taking antibiotics now, so the infection when I wake up, it should be a little less red, a little less swollen, not spreading. If it is spreading or looks any worse, then that tells me that the antibiotics may not be strong enough, in which case you may want to go back to your doctor and let them know that the infection doesn't seem to be clearing with whatever it is they gave me, because there are stronger antibiotics or different antibiotics that may work better. Okay, so those are some things that you could do for yourself to monitor and make sure that it's getting better and not worse, because we have to be our biggest advocates, right? All right, so let me show you guys what I'm talking about. So hopefully you can see that. You see how red that is? You see that? Now it goes a little below and a lot above my incision. And I did notice today, or just now when I got home, there's a little redness here. I don't know if the camera's capturing that. Okay, so it's actually spread. It started right here, this little circle, and then it spread to this. Okay, and now I'm noticing it here. So as of right now, I only took the antibiotic about a couple hours ago. So obviously it's not kicked in yet, but I did get the shot. So the antibiotic injection. So, you know, injectable antibiotics are always gonna kick in faster than oral antibiotics. So I'm expecting that by tonight or tomorrow morning, it's gonna at least halt where it is, or even start looking a little better, a little less red, a little less burning sensation, a little less swollen. And that's how I'm gonna keep my eye on it. All right, so now I'm just gonna use this marker and I'm gonna outline where all the redness is so I can keep an eye on it. All right, so let's see. So, you can see how swollen I am. I'll try to do this without flashing you guys. Yeah, so it's just very important to never take for granted the fact that we had a very big surgery. Uh-oh. That's gonna stay. We had a very large surgery, And no matter how meticulous your surgeon may be, complications are still always a possibility. It doesn't mean that you did anything wrong. It doesn't mean that the surgeon did anything wrong. Sometimes things just happen. And we just have to be very mindful and very observant of our surgery sites and incisions to make sure that they're looking good. So that's all I have for now. I'll keep you guys updated on what happens. I'm expecting things to improve by tomorrow, so I'll give you guys a follow-up. And I will be seeing my surgeon on Monday, like I said, when I fly to Colombia. So that's all for now. You guys take care.